To begin, gently lift the rabbit and slowly rotate back. Here we see an unfixed male marked by the 2 descended testicles on either side of the penis. Here we see a female with an identifiable vagina marked by the slit-shaped opening of the genitals. Start with the rabbit on a hard surface, like a floor or table. Avoid holding them in your arms as it increases the risk of injury. Administer pre-surgery medications intramuscularly in the sublumbar area, which is of the muscle that lines on either side of the spine. Aspirate back before injecting to avoid hitting any vessels. For most rabbits, a 25 to 22 gauge needle is ideal. However, older, unneutered males may require a larger needle as they are more likely to have tough skin. The rabbit will be sedated enough to begin prep for surgery 15 to 30 minutes after pre-medication, depending on the pre-med protocol. We recommend using this time to check for and placing a microchip. When the rabbit is completely sedated, place a mask and provide oxygen at 2 liters per minute using non-rebreather system. The isoflurane is increased in increments of 0.5% until they're completely asleep. If increasing isoflurane levels quickly, some rabbits will hold their breath. To determine depth, pinch the toes. If no reaction, the rabbit is ready to intubate. A non-cuffed endotracheal tube should be used. Never use a cuffed tube in rabbits. The size of the tube will vary depending on the size of the rabbit. Typically, a 2 to 3.5 tube is used. Make sure the tracheal tube is never kinked, as this can happen easily with small tubes. Here, Dr. Austin is using a semi-rigid scope to intubate. The rabbit should be in sternal recumbency and the scope should be at parallel to the table. The scope allows direct visualization of the endotracheal tube being inserted into the trachea. Rabbits will often cough upon successful intubation. Here, Grace Santos RVT is intubating blindly. Again, the rabbit is in sternal recumbency and always with a monitor on to monitor their heart rate and SpO2 concentration. Hold the head up perpendicular to straighten the trachea. If the head is held down, your intubation tube will pass into the esophagus towards the stomach. Optionally, you can place about 1/10 of a cc of lidocaine into the tube to numb the larynx. Rabbits have laryngeal spasms similar to cats. Continue to guide the tube until you hear breath sounds. This indicates that you're at the opening of the trachea. Then, in little increments and with a light twist, the tube advances until it slips into the trachea and the rabbit gives a little cough. Use pulse oximetry to monitor SpO2 and heart rate. During intubation, if the SpO2 drops below 80, stop attempting intubation and place them on oxygen for a couple of minutes. We tie the endotracheal tube in place with the rubber band. Avoid constricting the tongue with the rubber band. To prep the surgical site for spay, shave the rabbit from pubis just past umbilicus. To prep the surgical site for a neuter, shave the pre-scrotal skin, area around the testicles, and the scrotum itself. For a neuter, we do an intratesticular block with lidocaine. Typically, volume of lidocaine ranges from 0.1 to 0.2 milliliters per testicle. Aspirate back prior to injection to ensure you're not in any vessels. We use pulse oximetry as well as capnography for monitoring. The pulse oximeter can be placed on the tongue, toes, or occasionally an ear. We don't typically use ECG clips as extra shaving and alcohol is needed to get a solid reading and tends to cool the rabbit off. We use oscillometric blood pressure measurements, but a Doppler can be used as well. Ideally, SpO2 is maintained above 95%. Heart rate should be no lower than 200, depending on drug protocol. Respiratory rates of an anesthetized rabbit can range from 20 to 40 breaths per minute. Manual ventilation may be required if the rabbit is breathing poorly or end-tidal CO2 is elevated. Ideal end-tidal CO2 is 35 to 55. The rabbit is now prepped for surgery. For more information on rabbit health, wellness, and care, visit houserabbit.org.